sometimes there can just be some local tension in the upper cervical region. A lot of times when we're doing that test, it'll just be limited and the client will point in there as well. And what can happen, you know, at the base of the occiput from C1 down to C2 is there's some nerves called the greater occipital nerves. They can get stuck to the deep suboccipital muscles. They can get caught through the upper trap. They can get caught in a lot of different areas. And if you can get in there and get some of that tension, it's going to allow this to help to glide a little bit better. So the setup for this is essentially what you're going to do is you're going to have the client lay down, and you can have them right up against the table. That's going to let things relax. You're going to take this first hand and you're going to get some of that extension on that occiput. That's going to create that knife edge. And then essentially you're going to go down to about C3, and that's going to get that to open up. And when you do that, you're basically going to sink in there with your depth and then pull tension right up to the occiput. And your hand here will be where you will stop. So it's just above the occiput on there, and that's where you're going to pull in there as well. Stay very central and very localized in here. You don't want to go too far lateral because you're going to actually fall off of it. But when these nerves get jammed up, it can cause some big problems. So as we showed on the spine, you're going to take this opposite hand and it's just going to have the occiput right in there, and that's going to open that up. You're going to go down and find about C2, C3, and where you're going to go in there is you're going to sink just like that, and then that's going to get your depth as you open up, and then you're going to pull tension straight up. And with this one, you're not going to stand up, you're just going to pull that, and you're going to lean back and pull that through as you go right up to the base of the occiput. Your hand gives you an idea where you're at. And with this one, you want to get that extension. That opens that up. You're going to back off. You're going to pull that tension and come up nice and easy. You can see I'm using this opposite leg to kind of help with some of that motion as well. And when this area is dysfunctional, it can cause a lot of problems in there. But you don't want to go too far. You go to maybe about C3 is the furthest you want to go. Get some of that extension to open it up, and then you're going to pull that tension straight up. That's going to help that open up.